So let's get started. Today's session is Bridging the Gap Between Homelessness and Sustainable Housing in Dallas. I'd like to introduce your speaker, Dr. David Woody, the president and CEO of the Bridge Homeless Recovery Center. Dr. Woody earned a bachelor's degree in sociology from Dartmouth College and a master's in social work degree from New York University School of Social Work, and a PhD in social work and social policy from Virginia Commonwealth University. Dr. Woody's experience with homelessness comes as a result of employment with Volunteers of America, Texas, the Salvation Army DFW Metroplex Command, and with Catholic Charities Diocese of Fort Worth, Incorporated. Dr. Woody has a long history of engaging in services delivery and policy development and analyzing the impact of services to homeless populations. Dr. Woody's vision is to empower each guest of the Bridge, facilitating improved decision-making, reducing recidivism, and growing the Bridge in its capacity to reduce homelessness. It's an honor to have you with us, Dr. Woody. If you're ready, you can go ahead and start your presentation.
I really appreciate the introduction, Ms. Davis, and there aren't too many people who read all that and then you stop and think, is that is that who this is? Is that who I've grown to be? And what I would say to you during Black History Month, how about that? That history is really important, and that how I've arrived where I'm at currently is hopefully a model for the guests that we serve here at the Bridge Homeless Recovery Center, to have a plan and a passion in their right to find a home of their own is what we try to do. And so it's often good to be able to talk with our guests and our employees about the notion of being planful in terms of whatever dream that you might have. So again, Ms. Davis, appreciate you. I also want to say thank you to Dr. Jasmine Parker as well. It was great to be able to visit with you all several weeks ago to talk about sustainable you and what you all at Dallas College are doing. It's very important what it is that I have the opportunity to do this afternoon, to talk about homelessness, to talk about the homeless experience here in Dallas County from the experience of three pillars. And so I'm going to try my best to stay on point with the incredible vision that you all have for such an opportunity there at Dallas College. So again, thank you for the opportunity. For those of you who don't know, the mission of the Bridge Homeless Recovery Center is on your screen there. Hopefully you can see that. Our focus is to empower adults experiencing homelessness in Dallas with the tools to homeless recovery as they move into sustainable housing. Hopefully you would know that our location is just off of the Farmers Market area. We have been here at this location, 1818 Corsicana Street, about 2 blocks from City Hall. We have been here since 2008, and we're on the cusp of celebrating our 14th year at our location here in Dallas. Again, just to repeat, the Sustainable You webinar series is focused on 3 areas: equity, and I've provided some definitions here. I'm really big on folks having a grounding or a focus on what I'm trying to present. And so I want to use the pillars that Sustainable You has offered up to us as hopefully a framework to talk about homelessness and our work here at the Bridge today. So again, the pillars are equity, environment, and economy. And I've also supplied some definitions. I Googled the words and have come up with some definitional material: equity, the quality of being fair and impartial; environment, the surroundings or conditions in which a person, animal, or plant lives or operates; an economy, careful management of available resources. And again, those concepts are big, they're large. And what I would say to you as I get into my presentation is that the experience of homelessness is large, it's complex, and hopefully I'll offer just a little bit more information on that. I also want to lend this to you. We are in an environment now where the capacity to think critically about anything is being challenged. And so I want to just start off by hopefully opening your minds here, and having you think about the experience of homelessness, perhaps at least from a position of an open mind. And often when thinking about things with an open mind, you're able to think critically about what you're listening to, but also you're challenged by what it is that you may have heard, seen, or experienced before that. And so thinking about things critically, there's an issue, right? Everyone thinks. It's our nature to do so, but much of our thinking left to itself is biased, distorted, partial, uninformed, and there could be prejudice as part of it. Yet the quality of our life and that we produce, we make, we build depends precisely on the quality of thought that we bring to those activities. Critical thinking, the process by which the thinker improves the quality of their thinking by skillfully taking charge of the structures inherent in thinking and imposing intellectual standards upon them. Next slide. And so I want to just challenge folks thinking about things critically. On this campus, I ask our staff, our employees, to think critically. We too often bring to our engagements preconceived notions, myths, things that may simply be from our narrow perspective, David Woody's narrow perspective. And when you're dealing with homelessness, when you're dealing with other people, often you need to broaden that and to open yourself up to all of the greatness that is the human experience. The first pillar, equity, the quality of being fair and impartial. What I would say to you is that I'm coming at our work in regard to homelessness from a social work perspective. Okay? There are so many ways, thousands of ways to help people. And I come from a discipline, social work, which has some specific values, a code of ethics, et cetera, et cetera. And on the screen, you will see that I have tried to visualize exactly what social work is. Social work is concerned about the person, that inner circle, and that person in their environment. Kind of interesting when we think about sustainable you and its pillars, right? And the social work, you see an arrow there, the problem or change area. It's beautifully kind of visualized there as this nice firm arc. Social work intervention is what's worded there. But we know that lives are so unpredictable and intangible often. There isn't a firm boundary. And so that squiggly area, the gray and darkness there, is the actual area of work where we, social workers, have to be involved in what's going on in a person's life, and certainly how that person's life is affected by the social environment. One of the uniquenesses of social work as a helping discipline. And when I think about it, I've put a stool there. When I was talking with Ms. Davis and Ms. Parker, Dr. Parker, we were talking about the three pillars, equity, environment, and economy. And often they have described through Sustainable You that those elements have to work together to create stability, right? And what I would say to you here at the Bridge at a very high level in terms of leadership, and leadership is so important these days, right? We have a similar stool, okay? It just has an additional leg, okay? And we talk about it in terms of the services we offer, our resource development activities, how it is that we acquire the resources financially to pull off what we want to do in terms of our mission. We have an operations leg of things, right? And we then have a very important administrative kind of component as well. And so just as with sustainable U, economy, equity, environment, we want to get those things working together to create a sustainable experience. We're trying to create that same kind of stability here at the Bridge with a four-legged stool, okay? Again, critical thinking is so important here. A well-cultivated critical thinker raises vital questions, problems, tries to formulate them and describe them precisely. They gather critical thinkers and assess relevant information. Critical thinkers come to well-reasoned conclusions. They test them against relevant criteria and standards. A critical thinker thinks open-mindedly about alternative systems of thought, how you could reorganize your thinking and assessing. And lastly, critical thinkers want to communicate effectively with others, trying to figure out solutions to complex problems. And that is exactly what I'm trying to do with homelessness at the Bridge Homeless Recovery Center. Okay? A little context. Every year, large urban communities are expected by our federal office, Housing and Urban Development, to count the number of homeless folks in a community. Last year, that experience was really a very tangled, challenging experience because of the coronavirus and social distancing and spread reduction expectations, right? Fear. How can I get COVID, right? And so we moved, typically across the United States, the point in time count is done on the third Thursday evening of January. Because of COVID, it was moved to the middle of January. And unfortunately, or fortunately perhaps, the date of the point in time count here in Dallas and Collin counties was the time when Storm Uri hit the Metroplex. And so despite that, we had folks going out, counting people, counting the number of folks in shelters, et cetera, et cetera. And what you have on the screen here is the numbers that were counted on that evening. And what I would say to you is this: folks would challenge these numbers, right? The storm, coronavirus, et cetera, et cetera. Those are just two basic things. But these numbers, even if it's a beautiful, nice in Texas, warm 70-degree evening, these numbers are challenged one year to the next, because how can you be sure that you have counted every homeless individual family here in the Metroplex? But these are good starting figures for us. And during the time that the point in time count was done last year, you see on the far right, the second box there, a number, 4,570. That was the number of individuals on probably about a 7-day period that were counted as being homeless. For the Bridge, if you go just to the next box to the left, there is a number there, a total number of persons who are unsheltered, 1,432. And we at the Bridge are very concerned about that number, okay? Because we know that any given night, that is the number of individuals who will probably need the resources, the facility as a home that in the community is necessary to take care of those folks, to get them sheltered, and perhaps to offer them a space to at least contemplate what a recovery from homelessness experience is like. 2 years ago, there was a slight decrease noted in the number of folks who are counted as homeless. Okay, when that count was done in 2020, it wasn't so cold an evening, and there weren't a lot of reasons for folks to really question that decrease. But we here at the Bridge, we questioned it because prior to 3 months prior to that count, we were seeing on our campus nearly 900 individuals a day for services, although the numbers would claim that the number of homeless folks is going down. Okay. Our hands-on experience is that we were seeing 4 services on our campus. The Bridge was a home to at least 900 folks, which to us was a significant increase of at least 150 folks a day who were needing services. And so, again, thinking critically, okay, we want to, yes, use this as a template, a foundation to begin how it is that we assess the needs of the homeless and exactly how many are homeless here in Dallas County. Okay. I'm often asked, Dr. Woody, how is it that folks become homeless? What an incredible, because if you work in this area, every individual on our campus, and we call on our campus our clients, we call them guests. What's most important here at the Bridge is that the Bridge is the home of today, probably close to 400 individuals on our campus right now. Okay, and so to the left of this screen, you see some of the potential issues that could trigger homelessness: loss of a job, behind on paying a bill, change in family status, the use of substances, drugs, alcohol, if you're physically disabled or you have other health issues, if you are coming out of the criminal justice system, right? And how many folks are leaving incarceration into homelessness, right? They don't have a family member to go to, right? The issue of abuse, physical, sexual, or otherwise in your home, folks being evicted, okay? That's just the beginning, the tip of the iceberg in terms of the number of ways that folks would become homeless, right? I've described some pathways to homelessness, that you live in an area or a community where the resources are poor, that you're there's an impoverished experience in terms of your capacity to acquire resources, the issue of family destabilization, the issue of intimate partner violence, the increasing significance of health issues. The coronavirus is incredible. There are so many people, as many of you would know, who are listening today, right, who never thought that they would be financially in any jeopardy. And the coronavirus was that one thing which tipped them into homelessness: loss of a job, reduced finances coming into the home, being physically ill and unable, right, to maintain your lifestyle. The impact of any of those things on your social system, your social environment, right? The coronavirus has only enhanced or exacerbated pathways to homelessness. And in the helping profession that I'm in, with the helping organization that I'm a part of, we also have to be very concerned about what the barriers are to exiting homelessness, right? Criminal justice issues. If you have a criminal background, how that challenges your ability to find housing as a solution. Economic immobility, having the skills or talents, those abilities to be nimble in our current economic environment. Lack of quality, affordable housing. We know prior to the coronavirus that we were at least 20,000 units behind in terms of affordable or workforce housing in this community. Difficulty navigating systems. Our systems can be so cumbersome, unrelenting, challenging. And so I'm going to, again, ask you to think critically about the fact that homelessness is an extremely complex experience. And I will hear folks, Dr. Woody, why don't they just get a job? Dr. Woody, why don't they just go ahead and take care of their physical health issues? Get to a doctor. We all know, especially after the coronavirus, how challenging that can be for even the most prepared, educated person, right? I've had difficulty myself. Where's my mask, right? The discipline necessary to wear a mask. Are you kidding me, right? And so when you layer on top of that, having to do this kind of work, right? And trying to keep your family safe. There are so many extremely unique challenges for any of us, let alone a person who on the top left side of this screen may have encountered any one of these triggers to homelessness. The Bridge. It's not just a shelter. It's a homeless recovery center. You may be familiar with sheltering organizations who may open their doors for a meal, perhaps a shower, spiritual nourishment, and then in the morning, because of the lack of resources, staff, et cetera, they push folks out into the street. We are different here at the Bridge. We provide a variety of resources to adults experiencing homelessness, which we believe facilitate a path toward a permanent housing solution, right? Collaboration is key, and I'm going to talk a bit about the number of organizations, providers that we have on our campus, that we have intimate relationships with, that we trust, who we believe can partner with us to address a guest care and housing plan. That is a formal document, right, that creates an exit strategy from homelessness. And that's what we're about on our campus. All of this to say, we know the Bridge. I know I can't do it by myself. Okay, so the notion of collaboration is really important. And again, if you think about that stool and from sustainable use perspective, equity, environment, economy, right? Those things are working together. And the Bridge is in a amplification of that visual. We must be able to work together in terms of the environment, in terms of the economy, in terms of equity, to ensure that a guest can be facilitated. Their work can facilitate them moving into a housing solution that they can maintain on their own, that they can sustain. The Bridge is open 24/7. Okay. We've become recognized. Our model, having all of the resources right here on our campus, is really important. Okay. We provide basic needs: food, shelter, hygiene, healthcare, behavioral health, income services, care management. We help folks identify among all these solutions for housing, a solution for an individual guest we know that they eventually will be able to sustain on their own. Okay. Who we serve. You see the numbers here. I'll start at the right side of the panel here. And you see some of the barriers, the issues that homeless folks come to the Bridge with. Chronic health conditions, physical health conditions, nearly 50%, right, of our guests have that kind of experience. Developmental disabilities, mental health issues, substance use concerns, right? All of these barriers are ones that our professional staff, guest by guest, we have to assess what those issues might be such that we can prioritize them and facilitate that pathway, that exit from homelessness. Again, when we talk about equity and homelessness here in Dallas and Collin counties, it's a different experience than many other urban communities across the United States. Generally, when you look at statistics for other continuums of care across the nation, you would see African Americans making up 40, 45%. Here in Dallas and Collin counties, over 60% of those who are homeless are African American. There's messaging there. We can't ignore it. Okay? What I say to folks that at the bridge, what we offer is access to resources that many individuals, white or black, that they didn't have access in the community from which they came. There are so many guests that I engage who would say, Dr. Woody, one of the things that I love about it is that I have access to a resource here that I didn't have access to in my own community. And so that is a major issue that we, in terms of equity, need to ensure that our professional staff and our resources, our campus, is established in such a way that we are being equity sensitive. Okay, our environment must be sensitive to these kind of barriers that you see on the right-hand side of the page. And certainly, in terms of economy, we have to get to know our guests such that we can plan for how it is that they will be able to sustain their own housing solution once they leave our campus. Okay. Many of you would know folks, each of us have folks that we know, that we have talked to, and we have said, sir, ma'am, brother, sister, mom, you need to make some changes. And we know how difficult that can be. Many of us don't want to talk about how hard we work, right, to keep things copacetic, to keep them stable, right? Many of us daily, we're exhausted because we have worked so hard just to maintain the status quo. And that's no different for a homeless individual, the status from which they came. This model that you see here is described as the trans-theoretical model of change, Prochaska de Clemente, an extremely important model, which describes that change is a process. Okay? And for many individuals, we, especially when we engage them very early in their recovery from homelessness process, they may even be pre-contemplative, sleeping on the concrete. Our outreach team is out trying to move folks to a position to at least contemplate what their exit from homelessness might look like, right? On our campus, we want to create an environment where folks can trust the environment, that it's safe, that it's secure, where they can at least take a deep breath, right? And consider what are their options. And so this model is one that is very important, especially for our professional staff who may expect that change, what we offer here should create immediate change. People are people. Homeless folks are no different than any of us in terms of how it is that we engage or distance ourselves from the opportunity to change. Okay. Hopefully some of you have also seen this notion of Maslow's hierarchy. Okay. And I love this because self-actualization for us can mean that a homeless citizen is going to have a home of their own. But we know that underneath that, their capacity to manage that are some basic things that that individual must be dealing with and manage on the inside in order to manage having a home of their own. And here at the Bridge, we are really focused on, number one, ensuring that folks' physiological needs are taken care of. We have a closed closet. We sleep 300 people a night. That we have safety in shelter, a great safety team. That our shelter is warm. They're getting threatened with cold weather again. Are we ready? okay, to make sure that the heat is going to run on Wednesday evening, okay? They're expecting bad wind. Do we have all the hatches battened down such that folks will be safe? Safety needs, personal security. Where do I store my goods? I've got my whole life with me in a plastic bag. Okay, is there a place that I can store that? My health. We have a great partnership with Parkland Hospital. Can I get my physical health needs? We have a great partnership with Metro Care Services. Can I get my substance use needs, mental health needs taken care of? And certainly we're about ensuring that folks feel wanted and welcome, loving, belonging, beginning that internal process. Okay. The environment. Okay. Again, homelessness is extremely complex. We have to be sensitive, guest by guest, to what their needs might be. And so our next slide kind of describes what recovery is. Bridge is 24/7 homeless recovery center. We have day shelter experiences. We have night shelter experiences here. We have no barriers to getting onto the campus. Okay? A sex offender, an individual with a criminal justice background. We're inviting those folks to come in and try to craft an exit from sleeping on the street. There is no timeline on the access for service. And in fact, we have a kennel. Can you imagine if you have a canine companion and you want to come in and begin a recovery experience and you have to abandon your animal? They're probably not coming inside. And so we even have a kennel here. See my friend with the floppy ear there. Okay, he's one of my favorites. The basic services we offer, intake and triage, and assessment that's done by our intake specialist is so critical. That tees up how work on a care and housing plan will be initiated. And in fact, more important, is the bridge the best place for a person to come? Perhaps we can reunite, all right, reconnect an individual with their family. If that's the case, we will make that call. We will provide a bus ticket for a person to get back to that family member. Perhaps being in the homeless response system is not appropriate. And so we are also involved in diversion of folks from the system and trying to rebuild just enough a relationship with someone in their family. We offer showers, 3 meals a day, a laundromat. We have a barbershop and hair salon on our campus, right? Folks can get their mail here. They use the bridge as an address. Phone access, access to a computer. We have a great relationship with Dallas Fire and Rescue. Their technicians, EMTs are on our campus 12 hours a day. And last but not least, care management. Those folks, our professional social workers, orchestrate how it is that a guest is going to exit homelessness. Our collaborative network. We've talked a lot about equity in the economy, and we could not, again, do this by ourselves. And so you see some of the organizations that we partner with on our campus to meet the needs of our guests. We have, bottom left, several night shelter partners. Again, we don't have enough spaces, night shelter spaces on our campus to take care of the hundreds of people that we see here. And so we have to have relationships with folks who will care for our guests in the evening, and then they come back for their resources and services during the day. The Stew Pot helps us in terms of serving our 3 meals. Legal Aid of North Texas, helping folks who have a criminal background or other tickets or warrants that would preclude them from qualifying for housing. Parkland, the clinic here. The VA. There may be some folks who are mad at armed services and don't want to take advantage of benefits and resources that they have earned. We have a couple of their staff who will help to try to bridge that gap and encourage folks to take advantage of what they've earned. Okay? Employment, Workforce Solutions of Greater Dallas. We have 2 now of our own employment specialists trying to get folks employed and making a livable wage, really important. Okay? Dallas Housing Authority, Dallas Police Department, Metro Dallas Homeless Alliance, the City of Dallas, Office of Homeless Solutions, Office of Code Compliance. We have to work with everyone to address the needs of our guests. I did make just a statement about our kennel. Some pictures there, another great little canine friend. 16 kennel spaces. We've got a large outdoor run. It's climate controlled. And so when a guest come in, we expect that they would feed that canine twice a day, walk them twice a day. If they have a need for veterinary services, that they let us know what those are. A washing and grooming station. And when their canine is taken care of, they are freed up to contemplate and act on their care and housing plan. Dependency. Our society prides itself on the ethic of independence. So you can only imagine how difficult it can be for some of our intake specialists when they have a guest come across our threshold who is in tears for 20 minutes because they finally had to acknowledge that they need to ask for help. Our employees have to be incredibly sensitive to that issue and how interdependence in our society can be seen as a negative. Okay. Again, we're looking at how it is that we create the environment, the social conditions necessary for folks to become self-sufficient and to manage a home of their own in our community. We offer access to resources. We try to facilitate individual growth. Our environment must be protective, but just enough. We balance opportunity with responsibility, right? We are trying to, again, facilitate folks internally working with their own issues of how they manage the environment, how it is that they are in equilibrium in terms of their focus and management of their life, and ultimately how it is that they are able to manage from an economic perspective their own life in our community. Economy, again, careful management of available resources. On our next slide, we talk about how it is that we are about engaging our society. Next slide. And again, we are an integral component of life down here in this part of Dallas around the farmers market, okay? Our ability to meet the needs of homeless individuals has increased public safety. Crime in our neighborhood is down over 55%. We are increasing public health and quality of life issues. From an economic perspective, if you come down to the bridge and you will see higher dollar condominiums and apartments right across the street from us, okay? Property resources have increased over 250%. It's incredible what we have been able to do thinking about the pillars of sustainable you. We have a good neighbor boundary. We are about keeping the neighborhood clean. If there's we have relationships with all the local business owners. If they see a person in crisis, they call us and we try to engage that person and get them to come inside the bridge and receive services. We collaborate with Downtown Dallas, Inc. We're in communication pretty much daily with the Office of Homeless Solutions outreach staff. We participate in the Farmers Marketers Stakeholder Association, the Cedars Neighborhood Association, Deep Ellum, Central Business District. We are part, this is our neighborhood. And so from an environmental perspective, we're about all of that, okay? Vulnerability is extremely important, right? And how do we as a community manage indifference versus fear? Okay. I'm constantly talking with our employees about self-awareness. How can I, as a leader of this organization, continue to offer folks information, research, things to read that will enhance their own sense of self? Okay. Folks on our campus have to be aware of the impact that they have on other people. You can't imagine how much people watch me walking about the campus. How comfortable are you with that? You must be motivated, right? And acquire the ability to deal with special problems, especially of communication. When I was a student, I used to be the person who was sitting way in the back of the room, making cat calls and whispering. No, people can't believe what I do here. Okay, I've grown. I've strapped on some skills. I'm passionate about doing something about poverty. Okay, and I certainly want to understand social situations and the external events that contribute to developing and perpetuating problems. Okay, don't want to be indifferent, but I don't want to be handicapped by fear. We have a couple of slides about how you can get involved with the bridge. And so with that, I'm at a time, I would love to open it up for questions. What do folks think? Thinking critically, where are you with this?
Thank you so much, Dr. Woody. Oh, you can really see your passion. And so I'm so glad that you were able to come out with us. And so I don't want to waste 1 minute because we do have quite a bit of questions. So so first question is, how can individuals or organizations, fraternities volunteer to help?
If you go to our website, www.bridgehrc.org, there are ways that you can make your desires known. Again, we're just, as everybody is, we're just beginning to reopen up in terms of the coronavirus and having folks come directly back to the campus. Everything from helping out with walking our dogs in the kennel to engaging our guests who would come onto the campus for the first time and are lost, with getting them, helping out serving a meal on our campus. So there are several opportunities if you would check us out at the website. And in addition, there may be folks who are still kind of tenuous about getting out with folks. And so you would also see a laundry list, okay, of particular ways that you can commit your hard-earned resources to a guest and their recovery from homelessness. So again, I want to connect folks to our website, www.bridgehrc.org.
Awesome. And we'll go ahead and put that in the chat too, so people can visit your website. Next question. So do you have any suggestions on presenting the model that you described to our local council and community leaders?
As you can imagine, I am passionately trying to do that. And what I've done is to invite folks to the campus, right? What I would say to you is it's interesting how many folks won't come. I don't know how to understand that, but this is a critical issue for the city of Dallas, homelessness. It's been exacerbated by the coronavirus, okay? And so many of you may have seen recently that the City of Dallas Office of Homeless Solutions has initiated an experience for inclement weather. Okay, you may have a group or a church or a spiritual group who wishes to house. If you remember, go back to that slide where I identified, at least during Storm Uri, the number of folks who had no shelter whatsoever. Last week, we were very concerned about that number, right? And trying to provide them shelter from the extremely cold weather, okay? The Office of Homeless Solutions has been great, partnering to pull in other nonprofits, church groups, other support groups in the community to support the work that was done at the automotive building at Fair Park last week, okay? Because we know that there are a number of folks who, frankly, could have died, especially a couple of weeks ago when the weather was so cold. Okay, so that is a very important thing, and we've seen traction there with our community. But the other side of it, in terms of equity, the environment, and the economy, is what's happening in some neighborhoods that folks do not have access to resources, right? How can we ensure that at least Parkland Hospital has clinic facilities in all communities, that Metro Care services, right? Behavioral health, mental health, substance use services, that we designate resources to meet those needs in local communities. What's happening with education? Okay, I know that it's been extremely challenging for folks with school when you don't have, for example, the internet, access to the internet, right? Those kinds of things that happen at very young age, that trauma could influence someone's pilgrimage into homelessness in so many ways, right? Preparation for a job, preparation or talent for some certification program. How do we make sure that our community is taking care of these needs? Our folks in positions of power, council folks, how it is that you are communicating with them with what you see with your own eyes. That's what I'm going to encourage folks, empower people to do.
Thank you. So, can you go into any detail about how the bridge is funded? How are you able to sustain yourself?
Sure. We, through our relationship with the city of Dallas, what folks need to know is that our campus here, our 6 or 7 buildings at the corner of St. Paul Street and Corsicana Streets, is a partnership of the bridge, our 501c3, with the city of Dallas, right? Former mayor Michael Rawlings, in 2006, 2005, was very concerned at that time about homelessness. And he championed a bond package to build what it is that we're lucky enough to populate here on Corsicana Street. And so from the city, we get just under $4 million. And we then compete for resources, state for funding resources, city resources, federal resources to address homelessness in this community. And we have a donor base, individual donors who make donations to the work that we do here. And we have significant number of foundations, okay, that we've crafted a great relationship with, such that we can get to about a budget of around $12 million to provide the services to the guests that we see on our campus. And again, you can look for that kind of information, breakdown of those numbers on our website. Those we want for folks to know how it is that we fund the resources that we offer to our guests here, and to offer folks an opportunity to participate, to come alongside us as well here at the bridge. But as you can imagine, it is a day-to-day experience for us. We have a very strong resource development department here on the campus who is scouring all kinds of opportunities to meet the needs of our canine friends, our guests who have specific mental health challenges, how it is that we feed our folks a hot meal 3 days a week. All of that takes very targeted and strategic exploration and assessment of resources that are available in our community. And then perhaps most importantly, we must count every service that we deliver and be able to describe it in such a way that our donors, folks who come alongside us, stakeholders, that they know that we are being the best of stewards with the resources that they offer to us in terms of trying to help our guests find a home of their own in the community.
Thank you. And as a follow-up to that, we do have some community members a part of the presentation. And once we publish this, hopefully it will reach the entire Dallas community. So if an organization wants to build that relationship with the bridge, do they go through your website? Who can they contact?
They can go to the website, but they could also contact myself, and I'll give you my email address and phone number. My email address is dwoody, DWOODY, at bridge, BRIDGEHRC.org. Okay. Yes, we are always looking for partners. Okay. I can't say that we have everything available on our campus. And so there may be something unique that you would offer. Okay. That could come alongside us. Right now, we did a guest town hall last week. One of the ways that we identify how it is that we're doing and what else we might need to do is every 2 months, we have a guest town hall, right? Where we give our guests an opportunity to share with us how we're doing and what needs they think that our facility and our employees could offer to enhance their recovery experience on the campus. And somebody raised the issue of how it is that we could offer more physical health activities here on the campus, Zumba, yoga, that kind of, and somebody would say, well, with COVID going away, that may be something we could do. There may be someone listening to this right now who would say, what an incredible experience it would be to offer a yoga experience to females exiting homelessness and have that be an integral part of them becoming a more stable and secure individual who could manage a home of their own in the community. There are so many ways. And so, again, dwoody@bridgehrc.org, or my telephone number is 214-670-1150. And I can also give you the name of my executive assistant, Miss Mykesha Cox. That's mcox, MCOX, @bridgehrc.org. And her office number is 214-670-1136. Even when I tried to hide, she can find
me. Thank you. Yes. Okay, so it looks like we have time for one more question, and I would encourage everyone, please still put your questions in the chat. We will get him, Dr. Woody, these questions and coordinate reaching out to you individually so you can get your questions answered. Last question, how does an indignant or homeless person navigate the issue of losing their identification? Many government services or even job placement places require an ID. How do they navigate that?
That's one of the first things, Ms. Davis, that we try to do when we're doing an intake, right? Because yes, without an ID, you can't even make application for a job, for housing, to get a driver's license, right? And so we're lucky enough right now to have a relationship with the Stupot, right, who helps us with that. But we also have just established a relationship with a new organization that is helping us with making sure that folks can get an ID. And so part of the assessment process identifies right from the get-go, right, anybody who does not have an ID. And that may mean that we would have to reach back to the county where a person was born and the state where they were born to get that birth certificate, et cetera, et cetera. That's something that's in our bailiwick. We know that we must do that from the get-go. And that's just part, again, of the process of ensuring that we create with a guest a viable exit strategy from homelessness.
Well, Dr. Woody, thank you so much. And thank you, Mykesha. I know you're there in the background. Thank you both for joining us today. This was such a passionate presentation. And so this will be recorded for other people to.
Well, thank you, Ms. Davis, for reaching out several weeks ago. We didn't know what we had here, but hopefully it was of use to folks, informative, and I'll leave you with the whole notion of thinking critically. Okay, we need this in our community more than ever, and Sustainable U is just teeing this up. Equity, environment, economy. Thank you, Ms. Davis. Thank you, Dr. Parker, for allowing me to join you all.